and I and
Thanks for coming.
yeah, okay. And yeah, I hope that you will enjoy as much as I will. So I do not want to take any more of your time for my introduction. I think that what is more more important than me is the subject that we will cover together together. And yeah, today I will talk about eccentric training, eccentric contractions, how to apply eccentric training in practice, in which volume, in which intensity, what is the benefits of eccentric training, what is the, let's say, negative effects of eccentric training, how do we actually recover from eccentric training. But first of all, I just want to share a few thoughts that I wanted to share with you. First of all, yeah, I would really like to hold this like a call, not like a strict presentation. And yes, please turn your mics on, and whenever you want, you can jump in, ask me anything, share anything. Or if you are not agreeing with anything, with something that I just said, that's fine. I think this is the way of learning, and after this call, I think that we all together can be a little smarter and better coaches. So just for the start, if I can turn back the clock and look at myself 3 years ago, I would say that I was a really good learner. I will learn something and apply something in the practice, but I wasn't so good thinker, especially critical thinker. And I think this is really important today for eccentric training. If we want to know more about eccentric training, I think that we need to go a bit deeper in the anatomy, biomechanics, and especially physiology. And by saying that, I really don't want to make things complicated. I really love really simple and stupid approach, because if we know how to explain something really simple, I think that actually we understand it. If we are unable to explain it really stupid and simple, that I'm afraid that we don't understand it either. So let's keep it simple, let's keep it stupid, and let's make this like a call. So please just guys who you having a mics on, I have some background noises, so maybe if you just turn off your mics until you will have some questions for me. Yes, thank you. So yeah, let's start with our subject today. You will see that I'm not a presentation guy, and by saying that, it's not that I don't know how to make a good presentation, but I really want to keep it in talk, and I think that what I have to say is maybe more important that is written on the screen. So before we start our subject today, let's go a bit deeper in the physiology, and I will try to make it as simplest and as stupid as I can. So when we were starting with some kind of strength training, we have to know that we are applying some muscle tension. So muscle tension can be active. You can see it on my right side of your screen, and it can be passive, or like you can see it from your left side. When I'm applying the active tension, this is mostly through my concentric phase of the working, and when I'm applying passive tension, it is more through eccentric. I would use like deadlift for example. So let's say if I'm holding if I'm holding a barbell with 100 kilos, and as I'm lifting the barbell up, I'm just providing the active tension to my structures of my body, to my muscle fibers. And when I'm lowering that the same amount of load, I'm just getting to eccentric phase of the movement, or I'm providing the passive tension to my system. So we have to know that both active and passive tension can give us response, and this response we call hypertrophy. Depending of the contraction mode, is it from the active tension or passive tension, we can get a different hypertrophy response. So as we are speaking about the concentric training, and by concentric, I mean applying the active force, I will get the more hypertrophy, a more muscle volume, but this hypertrophy will be more will be more in wider cross-sectional area, or we can call it hypertrophy in diameter. On the other side, when I'm lowering the weight, I'm getting to the eccentric part of the movement, I will get more passive tension, and this passive tension will result in more hypertrophy in length, and we call it longitudinal hypertrophy. When I'm speaking about fiber diameter, or sorry, the background noises, if you can just turn the mic off, thanks. Okay. So when I'm talking about the change in the muscle size in diameter during the concentric contractions, I'm actually adding more actin myosin cross bridges, and I have more myofibrils in parallel, and this will give me more wider cross-sectional area. And in the other hand, when I'm applying passive tension through eccentric phase of the motion, I'm adding more sarcomeres in series, and I'm getting more like longitudinal hypertrophy, or if I can make it much simpler, I'm getting the my muscle fascicles or muscle fibers a bit longer. So this is the outcome from depending what tension and I'm using in my training. So if my tension is coming from active elements, then I will get the more hypertrophy in diameter. And if I'm getting the more tension from passive elements, then I'm getting the more longitudinal hypertrophy. So if we want to dig deeper in like physiology, we have to know that when I'm applying the passive tension, I'm getting the passive tension from structural elements like titin, and when I'm working through active tension, I'm getting more active myosin cross bridges, and this is the result of one or another muscle tension. So we have to know that the amount of passive or active tension is determined by muscle length, by contraction type, and speed when lengthening. I will get to this really soon. What is really important to just remember that single muscle fibers will provide more force when lengthening than actively shortening, and this means that we are much stronger in the eccentric contraction mode than in concentric contraction mode. This is really important to remember, depending on the literature that you are following. I can say that we can conclude that we are 20-30% stronger when we are lowering the weights, comparing when we are lifting the weights. And so this is, I think this is the main important between concentric phase of contraction mode and eccentric contraction mode. So one more time, during the active tension, this is when I'm lifting the barbell up, I will get the more hypertrophy in diameter. And when I'm lowering the barbell down, I will get the more hypertrophy in longitudinal hypertrophy, or I will get the more fascicles length. So this is the different outcome. And we will soon come to some conclusion and some implication in practice, when to use one and when to use another. So I was saying that I was not the best presentation guy, but I would share my whiteboard here for you, and I will try to sketch something for you. I think in that way that maybe it will be much simpler to you. So I want to speak about level of effort. The level of effort is really important variable in strength training. So we have to know when we are applying eccentric training that effort is a bit higher than in the concentric training, but not in every eccentric phase of the work. So if you just let me a second, I will sketch two graphs for you. So one is here. So let's say that we will call this force and time under tension. And this one here, we will basically call it muscle unit, sorry, or motor unit activation or recruitment. So I was saying that there is a difference between eccentric training. So we have to know when we are doing the, sorry guys, if you just can turn the background noise. Yes, okay,
as they
please.
come in. No
Okay.
worries. Yeah, I think it's just new ones that come in every now and again. Sorry, mate.
Yeah, okay. No, it's no problem. So, okay, so there is a difference between eccentric contractions mode. When I'm dealing or when I'm working with normal strength training, and when I'm lowering the same weights that I lifted before, we cannot say this is eccentric overload. This is really important to understand. If we want to get the eccentric overload or like supramaximal eccentric contraction mode, we need to lower the higher amount of load of weights that we can lift actually. So the first graph will be, I will just sketch for you what is happening when I'm applying a supramaximal eccentric only training. So when I'm applying supramaximal eccentric training only, so I have a high level of effort. So I will sketch it like this, and I will get one more. Okay.
Sorry, is it only me? Is it only me who cannot see the screen? Your screen sharing?
Okay, can you see my screen or not?
Yeah, I can see it.
Okay.
Can you just message if you guys in the chat, please, if you guys can see the screen or not? Just say yes, and yes if you see the screen, no if you don't. Please, just maybe a few of you.
Yeah. Okay.
Okay, so we do see it.
Okay.
Thank you.
So I was speaking about level of effort, and you will see now that the level of effort is really high. And by what I'm meaning by level of effort, we have to know when I'm lowering the weights, that is the load that is much higher than in my concentric phase. In my eccentric, I have the motor units, that's activation of all motor units of all muscle fibers. And by that, I think about the muscle fibers in type 1. And we know that we are speaking about slow twitch muscle fibers or more oxidative muscle fibers. And because level of effort is really high, then because of this, I have also activation of motor units of muscle fibers in type 1, and we call it less oxidative muscle fibers. We call it fast twitch muscle fibers. And this is just because of the level of effort. On the other hand, when I'm applying eccentric training that is not eccentric overload, so let's say again, if I'm lowering the same amount of weights that I was firstly lift, I have a less level of effort, and because of this less level of effort, I will activate or get the more recruitment of the muscle units of the muscle fibers that are slow twitch. So we have more here activation of the muscle fibers in type 2 than in type 1, and also we are failing here to train the fast twitch muscle fibers. And this is the difference between here supramaximal eccentric training and eccentric training that is not providing any kind of eccentric overload. So every time we want to add eccentric overload, we need to use the higher amount of load or higher weights that we are lifting up. And this is the main difference between using the supramaximal eccentric training and eccentric training during the normal strength training. So this is the main difference. And I think this is now really, really simplified and really, to be honest, stupid. And I think it's really easy to understand. So if you have any question about this, yeah, just let me know. Okay, if there is no any question, I will just go on. So one more time, I'm applying muscle tension. Muscle tension can give me the predominantly from passive elements. From passive elements, this is my eccentric training. And if I'm applying muscle tension for more predominantly active elements, this is my concentric training. My concentric training will result in hypertrophy, but this hypertrophy will be more hypertrophy in diameter, much wider cross-sectional area. And when I'm getting the hypertrophy response from the eccentric training, from the passive elements, I have a more hypertrophy response. I'm adding more sarcomeres in series, and I'm getting the more longitudinal hypertrophy, or I'm getting the more fascicle length, I'm getting the more fiber length. So this is, the simple distinguish between the concentric and eccentric training. Also, we have to know that not every eccentric training is eccentric overload. One more time, when I'm dealing with 100 kilos and I'm lifting up and I'm with the same amount of load, I am going to my eccentric phase of the movement. This is not eccentric overload. I need to use much higher load to be eccentric overload. So how I can get eccentric overload is in example like this deadlift. So let's say I'm lifting the 100 kilos, and when I lifted it up, somebody put let's say 15 kilos on each side, and I'm lowering this amount of weight down, and in that way I'm getting actually the eccentric overload. The one more example how I can get the eccentric overload is I can lift to the concentric phase of the movement. I can lift object or weights bilaterally, and then I can lower it unilaterally. So this is for sure eccentric overload on my one extremity. And the main difference between eccentric overload and eccentric training that is not providing overload to us is the level of effort. And level of effort, I think, is a key discriminant between eccentric training, which is not overload, and supramaximal or eccentric training, which is for sure overload. So because of the level of effort, we have more activation of fast muscle fibers, fast twitch muscle fibers, muscle fibers in type 2. Sorry, I have a mistake here. So this is type 1 and type 2. And this here, muscle fibers, they are easily fatigued. They are less oxidative, and this is fast twitch muscle fibers. This here is a slow twitch muscle fibers or more oxidative muscle fibers. So this is the main difference between supramaximal eccentric training and eccentric training that is not providing us eccentric overload. And because of the level of effort here is much lower, then I have more activation of slow twitch muscle fibers, and I don't have activation of fast twitch muscle fibers. So if I'm a bodybuilder, I will get the hypertrophy response from both of these training regimes. But if I'm training with athlete, then maybe, just maybe, I will get the more benefits if I'm using some kind of eccentric overload training, and mostly because of injury reduction. But I will come to this a bit later. So what is happening if I am just lowering my eccentric phases slower? I'm just getting more time under tension. But because the level of effort is really low, I'm just getting activation of slow twitch muscle fibers. And I'm actually just, because of this low level of effort, I'm just having hypertrophy and more time under tension in slow twitch muscle fibers. So I really need high level of effort to be able to activate all motor units of all muscle fibers. And this is the main difference between the supramaximal eccentric training or eccentric overload, or eccentric training that is not providing eccentric overload. So I will get back to my presentation. You just give me a second.
I just have one question, if you don't mind.
Yes. Okay.
So that all makes complete sense, obviously, to me. Hopefully everyone else. But my question would be: say you were saying that, as we know, eccentric we're able to overload 20 to 30% more eccentrically, and that's where that supramaximal comes in. What would happen if we were to theoretically, I'm just thinking about thinking a bit outside the box here. What would happen if we were to load at like 100%, but spend like 10 seconds eccentrically loading down? Would that still be?
No, still level of effort will be lower.
Yeah,
So
okay.
I'm not sure that we will address the fast twitch muscle fibers, to be honest.
Yeah.
We are just getting the more time under tension. And I think that level of effort is actually, it's a key here in understanding difference between the supramaximal and eccentric or eccentric contraction that is not providing overload.
Awesome.
Yeah, it's just getting more time under tension, but for sure you are right. More time under tension will provide us more hypertrophy response, but because the level of effort is low, only to the slow twitch muscle fibers.
Yeah, but it's not like the level of effort would increase because of the time under tension. We
No,
need the level of effort
yeah.
from like the actual weight.
Yeah, we need more load, and more load will provide more level of effort. And this is the reason, and the reason of this is because we have more activation of titin. So I really do not want to dig deeply in the physiology, but what is the main cause? If maybe I can also answer on that way to your question. The titin molecules are much stiffer. They're much stiffer, and we need, they are like tendons, they are viscoelastic, and we need high level of force and high level of velocity because the titin molecules are stiffer. So if we add more velocity and if we add more level of tension, more level of effort, we will get actually activation or stretching of titin molecules. And yeah, if we are able to activate more titin, then we will get for sure more force production. So yeah, I think this will be I think answer on your question.
Amazing, thank you so much.
Okay, so just a second, I have a freezing camera here. I don't know if you see me or not. Yeah, just give me a second, please. I will just try to reconnect my camera again. Sorry. Okay, just give me a second. Okay, so I'm here. Can you see me? Yeah, everything's okay now. I was freeze for some time. So yeah, this is the main difference between submaximal and supramaximal eccentric effort. So I want to speak about when to apply eccentric training. So we said that I will speak today about applying the eccentric training mostly in rehabilitation. So I think that if you would ask me what is the best example where we can apply eccentric training, I would say this is for sure hamstrings, and hamstrings mostly because of the architecture. So if we can take a look at the picture in front of you, you will see a different muscle architecture. You can see on the left side is something that is more corresponding to my hamstrings, and on the other side you will see the architecture that is more corresponding to my calf muscles. Let's say my soleus. If you take a look at the right, on the left, you will see really long muscle fibers, muscle fascicles, and on the right side you will see that they are really short, but they have much wider cross-sectional area. So what does this implicate to me? Maybe, just maybe, when we are dealing with hamstring injuries, that my first premise is to apply eccentric training because of this architecture of hamstrings. So by eccentric training, yeah, I'm keeping the hamstring fasciculus long, and maybe, just maybe, when I'm dealing with calf injuries, soleus injuries, maybe I would apply some isometric training or quasi-isometric training, but I will get to this soon. So if I can get back on the hamstring injury, yeah, hamstring injuries. One more thing that when when I'm thinking about injuries, what is the most important in rehabilitation? If we truly understand what is the mechanism of injury, I think this is the key. This is for sure the number one. The second thing is if we really understand the tissue that we are rehabilitating, and by tissue I mean that we really know what is the type of the tissue, what is the architecture of the tissue. Is it a wider cross-sectional area? Is it a longer muscle fascicles? And what is the amount of slow versus high twitch muscle fibers? So if we can stick to the hamstrings, and I would say that there is two main mechanisms of hamstring injury. One for sure is sprinting mechanism, and the second one is stretching mechanism. But in mostly 80% of all hamstring injuries, more than 80% of hamstring injury will come from sprinting mechanism. And why is that? Because we have actually two biomechanical positions when we have the most hamstring injuries. This is the late swing phase of the leg, and when my leg is touching the ground, because I need to absorb really high amount of forces. What is happening in these two situations? My hamstrings are going through active lengthening, which is for sure eccentric contraction mode, and they need to absorb really high amount of forces. And because of this, I think that eccentric training is must do when we are doing the rehabilitation of hamstring injuries, because simply this is the mechanism of injury in the first place, and architecture of the muscle is just implying to us, yeah, we are dealing with a tissue that has really long muscle fibers, muscle fascicles, and then that we need to keep them really long and really strong. And also, if you ask me, is it more important to keep the hamstring long, or if we are able to make it stronger? I would say maybe if we can make them stronger and more resilient to load, I think this is much better just by lengthening them. And I will come to this really soon. So stretching mechanism, injury mechanism, and knowing the tissue that we are doing rehabilitation on is a crucial for the efficient rehabilitation. So the one more thing about the hamstring injuries, I would say that if we take a look at this architecture, you will see that we have really long muscle fascicles, but we have really slow short tendon here. On the other way, we have a soleus, a really wide cross-sectional area. The muscle fascicles are not so long, but we have really long tendon here. This is our Achilles. So what is this applying to me? If I really understand the tissue that I'm dealing with, that I will know that maybe eccentric training will be better for dealing with hamstring injuries. And this tendon is really short and is not so efficient in storing and releasing the elastic energy like maybe Achilles tendon. So what is happening with injuries when we are rehabilitating the soleus injuries or calf muscle injuries? We need to know that they are working in quasi-isometric state of working, which means that there is no big stretching or shortening the muscle fibers, and that tendon is the one that is dealing with the load, that is actually collecting and releasing, storing and releasing elastic energy. So I think this example here maybe is a perfect example how to start our rehabilitation. So one more time, mechanism of injury, and the second for sure is that we really truly understand what kind of tissue we are dealing with. What we know about eccentric training more. If we truly want to understand eccentric training, we have to know that the physiology background of this, and I was speaking about this in the beginning of this presentation. So we need to know also that when I'm doing the eccentric training, actually I have a more muscle damage than from concentric training. So for sure, I have to know when I'm applying eccentric training, I also need to think about rest periods or recovery time. I need to know that eccentric training, especially if I'm doing supramaximal eccentric training, that it's really fatiguing. And when I say it's really fatiguing, that I need at least 48 to 72 hours before I can apply again some kind of eccentric training. So what we must know more about eccentric training is that this is one really nice presentation from Timinis. This is a presentation on hamstring injuries, and we have to know that we are starting to apply eccentric training, that we are getting more fascicle length, and you can see it here that eccentric training will provide me more with fascicle length, and this is concentric training, and this is the outcome of concentric training. And concentric training will get me more shortening of the muscle fibers, but more hypertrophy in diameter, more wider cross-sectional area. So depending on the tissue I'm rehabilitating, I'm applying maybe more eccentric training. So if I'm dealing with hamstring injuries, for sure, I need to apply the eccentric training. So not just that I will get more fascicle length from eccentric training, but also I will get a more force and I will be more stronger, at least 20-30% than from concentric training. I'm not saying that I'm throwing up, I'm not exclusive, and I'm not throwing the concentric training from my training and rehabilitation. I think that will be really crazy, but I think that emphasis on eccentric training in the rehabilitation of hamstring injuries is a key. So when I'm start to apply eccentric training, I can see that after 2 or 3 weeks, I'm getting the adaptation in fascicle length. But I have to know that if I spend 2 weeks with detraining, with deload, and not exposing my tissue to eccentric training, that I will lose this adaptation completely. So what this is implying to me in practice. So I really want this call and our meeting today. I don't want just throw some informations to you. I want you to know where to use this information in the practice. I think this is most important. So if I know that I can lose eccentric or adaptation from the eccentric training after 2 weeks of detraining, so I have a question for you. When you think it would be most to get awareness to our players, to our athletes, to our clients to apply the eccentric training? Or what is the red flag or danger zone?
Feel free to put your microphones on and yell, guys, rather than using the chat. Ivan, we've also got a question in the chat, so we'll get to that after this one, if that's cool.
Okay. So when my player is finishing the season and he's going to vacation, and this vacation would last for 2-3 weeks, if I let him go without eccentric exposure, I will completely lose the whole adaptation. So I really don't want to bother my players after end of the season with training. I really want them to forget about mostly the football. And I just said to them, okay, enjoy yourself. Don't think about the football, but please, after 8 or 10 days, we will just do one eccentric training exposure to your tissue, so we can keep the adaptation and not to lose adaptation. And if we lose the adaptation, he's coming to off season and the preseason, and we need to spend again time to get this adaptation. So this is really, really important to understand that, yeah, we can get eccentric training adaptation after 2 or 3 weeks, but if we do not train, or if we do not expose our player or our client to eccentric stimuli, that he will completely lost the stimuli. And this is really important. And I see the problem in rehabilitation when somebody is dealing with let's say quadriceps or rectus femoris injuries, and the whole focus is on quad, and then we are not applying any stimuli to the other tissues of the body. Then we could forget about, let's say, about the hamstrings, and this is really important for me. This is like red flag. This is the really danger, and not to lose the complete adaptation. So if you are dealing with rehabilitation of some other injuries, like I said, quad or something else, I think it's really important to keep the eccentric stimuli for the other tissues on the body, not to lose the complete adaptation. And especially in the off season, when your athlete is going for the vacation, yeah, don't bother him with training. Rest is really important, but after 8 to 10 days, just send him some training that will provide him eccentric stimuli. And what is really nice about eccentric training, it doesn't have to be in really high volume. And when I'm saying that it doesn't have to be in really high volume, actually it can be in really, really low volume. So what is really interesting in eccentric training is that when I am working in eccentric only contraction mode, there is no failure. So if I ask you if you can do, let's say, 100 Nordics, yeah, you are able to do 100 Nordics. If I ask you, can you lower 100 kilos in deadlift for 200 times? Yeah, you will be able to lower, because you always can lower the weights down, or you can always lower yourself down, but you can always lift the same amount of weights up. And what is this implying to us is that maybe the eccentric training in low volume will provide the same stimuli as eccentric training in high volume. And if let's say I'm doing the Nordics and I give my clients to do 20 Nordics, only the first few reps will be stimulative and everything else will not be stimulative. So it's really important that we understand the eccentric training applications in practice. So we have the confirmation from scientific side. We have a really nice paper from Lacombe, and we have a really nice paper, I think, from David Opar, and we can see that high amount of high volume eccentric training and low volume eccentric training will provide us the same results. So yeah, this is the reason, because we can get to failure in eccentric training, and because of this, only the first few reps are stimulative. So when I'm doing the eccentric training, especially supramaximal eccentric training, I'm not going over 4 or 5 reps in every set. So this is really important to understand. Also, really nice piece of paper from Matt Craig. This was a replication of football match on the treadmill. And what is really important and really nice finding here is the first graph is, you can see this is eccentric strength deficit during the game. And you will see down, this is the concentric strength loss on strength deficit during the game. So we know that football game is playing around 90 minutes, 90 plus minutes. So this paper, when they put actually player on the treadmill and he was running for 105 minutes. And what we can get from this paper as a result, you can see by the end of the first half, that we have significant eccentric strength loss, and as we are getting closer to the end of the game, we have even more eccentric loss. And what is really interesting, that 15 minutes in the halftime was not enough to actually restore this strength loss. On the other side, yeah, we don't have a concentric loss during the game so much as eccentric. And we have to know that DOMS effect, the inflammatory effect, are still here 72 hours after the game. So we have to know when I'm applying the eccentric strength training or eccentric stimuli, which is eccentric overload to my client in significant volume, I need to know that I need at least 72 hours for him to be fully recovered before I start again with the eccentric training. So when I'm talking about eccentric training, I'm not just thinking about the strength training. I'm not just thinking about lowering the weights like in the deadlift, like in the squat or something else. Eccentric training, sprinting is also eccentric training. Change of direction is also eccentric training. So we have to know that sprinting will provide us with eccentric stimuli, which is unable to reach actually in the gym. So we have to know that if my player is like, say, let's say he's covering 300 meters during the game on high velocities, I have to know that this is also eccentric overload. And why this eccentric overload? Because my hamstrings are actually, they're working a bit different than my calf muscles. So if let's say I start the running and I'm running at speed of 2 meters per second, I have really low hamstring activation. But if I start to run 8 meters per second, I will have really, really high hamstring activation. And we know from some papers that if I'm running at 8 meters per second, this is still not my max velocity, my top speed. This is my submaximal speed, but I have to know that my hamstrings are actually dealing with the forces that are more than 140% more than maximal voluntary isometric contractions. So for sure, this is the eccentric overload. On the other hand, my soleus at different speeds will pretty much generate the same force. So this is also really important to understand when I'm applying eccentric training, especially eccentric overload training with my clients. So we have to know that if we can make some conclusion until now that not every eccentric training will provide the same stimuli. The supramaximal eccentric training or eccentric training that will provide eccentric overload will give us different hypertrophy response, high level of muscle tension, high level of effort, and if I'm applying eccentric training through eccentric phase of normal strength training, this is not my eccentric overload. I also have to know that fatigue from this kind of training is really high. I have a more muscle damage, and my recovery for this kind of training should be a bit longer than from concentric training. This is and when I'm speaking about the muscle damage, and I'm not just speaking about pulling apart the muscle fibers or sarcomeres, I'm also thinking about the biochemical process that is also included in this kind of muscle damage or fatigue. And we have really nice paper. I will share it with you right now. This is.
Can I just jump in really quickly, if you don't mind, just to answer the one question from Jorge?
Okay.
Sorry to interrupt you. He said, just what is the difference basically between active and passive? So passive and active lengthening. So that's
okay.
Yeah.
Okay. So it's not passive and active lengthening. It's passive and active tension. Okay. Let's go back on the beginning of my presentation. So this here on the right side, this is my concentric regime of work. Actually, I have active tension. I have a shortening of the of muscle fibers, and here passive is lengthening. Okay, so this is the passive tension.
I hope that answers your question. So concentric, essentially, and
this
eccentric.
Concentric. By active tension, I mean concentric, and by passive tension, I mean eccentric. Okay.
Hope that helps you, Jorge. Yep.
Okay.
Thank you. Yeah.
But if I can maybe explain my answer, there are also a few pieces of paper that are showing to us that when we are dealing with eccentric training, that athletes, that they are capable to have more control or more active lengthening in the eccentric regime of the word from the sedentary people. So basically, is a skill. And also, when I was talking about the fatigue from eccentric training, there is really nice paper from Benjamin Kahn, and it shows us that when we are speaking about the muscle damage and muscle fatigue, that we should not just think on the muscle, but we also have to think about the central nervous system and our CNS. So after the eccentric training, our CNS is really taxed, and not just cognitive, but also the perception of the load. So I don't know how many of you actually tried really supramaximal eccentric training, and you would know that it's super taxing, not just for your local tissue, but also for your CNS, and you are pretty much burned and tired after this kind of training. So it's not just local fatigue, it's global fatigue, and this is also fatigue that is also affecting our central nervous system. And when I said about the central nervous system, science showing us that when we experience a really high cognitive demand or cognitive perception, and when my CNS is really taxing, so my CNS in the next few days, let's say 2 days, 3 days after the training, is really taxed, really fatigued, and it's unable to provide us again high level of effort. And again, if I don't have high level of effort, I'm unable to activate all muscle units, all muscle fibers. So I used to say that we are not just a coaches, but I think that we are a stress managers. And for me, stress is stress no matter where it's coming from. It can get from the training, it can get from the drinking the night before the training. It's all the stress, and we have to know that also the CNS fatigue is here present also after the really high eccentric training. So don't just think about the muscle, about the soreness, about the inflammation process, but also try to think about the CNS fatigue. So if you prescribe your athlete really high demanding eccentric training, or let's say by sprinting, let's say let's say my athlete is playing the game on Saturday, and on Monday I give him a sprint training. So it is for sure eccentric overload. It is really demanding. It's really fatiguing. And imagine if I give my client on day after, I give him some Nordics or some exercise that is again supermax eccentric. You have to know that you are burning not just or his local tissue, but also his CNS, and his CNS awareness will just slow him down, and he will not be able to express mass force in the few days or in the few next training sessions. So this is really important to understand, that not just local tissue, but also the CNS. And try supramaximal eccentric training, and let me know how you feel immediately after the session, and let me know how you feel the day after. And you will be pretty much burned. So you have to be really careful when you are applying the supramaximal eccentric training to your athletes. And especially you have to be really careful if you are doing this in the in-season. You don't have too much time to apply eccentric overload in the season, especially if we are talking about the English Premier League, when we have the period from, let's say, September until up April, that players actually playing the game every third day. So you are unable to apply eccentric overload day. I think if you apply that, you are risking too much, that your benefit, it is more risk than benefit. So you have to be really careful. So eccentric training will give you a lot of benefits, but also be careful. Be careful when you play. I think that most delicate is when to apply eccentric training in the training week. But we will come to this really soon. Okay, so
I've got one more question in the chat from Mirko. He was asking if you know which kind of subjects were tested in the study measuring fascicle length.
Okay. In the fascicles length, this study from Lacombe.
I'll get Mirko to put his microphone on if you can talk, or just write in the chat. Yeah, I'm assuming it's that one, either that one or the previous one. Yeah.
Okay, but I have to say that we have one paper from, I think, David Opar. So David Opar, I think he's one from the team from Australian Catholic University. They form hamstring research group that is, I think, active for last 4 or 5 years, and the one paper from David Opar is on highly trained football professionals in Australian football league, and they come to conclusion then that players that they are coming in the preseason with the fascicle length that is lower than 10.26 centimeters, that they had 4 more times injury risk than the players that have shorter muscle fascicles. So if this question was applying, is this on highly trained people or sedentary people? Yes, maybe we should look at the paper from David Opar, and you will see that this research is also done on the highly trained football players.
That group in Australia, by the way, I actually worked at the same football club as Timmins, and that research group was leading the way for the last years in terms of eccentric hamstring research. So there's they've put in a lot of research into that. Yeah, so I don't think it's just one paper.
No, it's not just one.
Read about a million, Ivan, but just more for Mirko and everyone else. There's a hamstring research group in Australia of like 4 or 5 guys that are looking at this intensively. So yeah.
Okay, so yeah, you have people like Bas van Horen, you have Nicole van Dijk, you have Joke Schuremans, you have Timinis, you have David Opar, and many others. So you can follow them. It's here in Europe we have also the Hurda Mendiguccia, we have JB Morin, we have Johan Lahti. So I think this is all a really nice source. You can follow them, and you will see that the most of the paper is coming from highly trained professionals. So it's not just on the sedentary people. So I know that there is a lot of question, and this is actually a legit question: is this on highly trained professionals or in the sedentary people? But year by year, we are getting the more papers that has been done on highly trained professionals. So I think also this is really important for our practice, but this is also a really good question and really good actually way of thinking. So yeah, so if I can go a bit further. So yeah, this is the paper from Bas van Horen. This is a paper, I think, from February from this year, and then he was able to show that we had 3 hamstring exercise. One was RDL, one was Nordic, and one was hip extension on the Roman chair. But I want to stick to the Nordics. So yeah, I was saying in the beginning, if you ask me 3 years before what I think about the Nordics, I will just say, yeah, it's really nice exercise, but I really didn't know why, to be honest. And yeah, you can be critically also to everything. Please be critical to whatever I said here. And yeah, my critical approach is firstly, I'm looking myself really critical. And yeah, 3 years ago, I really didn't understand what the hell I'm doing with the Nordics. Yeah, 14 reps. Is this really a goal? I didn't understand that the adaptation behind the Nordics, yeah, what is the implication in practice when I'm dealing with the Nordics. So we have to know that the Nordics is a supramaximal eccentric training. And I on the Instagram, I see a lot of coaches sharing their progression with their athletes, and they are able to come up from the Nordics for 8, 10, 12 reps. And this is really amazing. But we have to know if I can get myself off, and when I'm going down, this is not eccentric overload. So this is just eccentric phase of normal strength training, and that I'm not getting the same hypertrophy response as from eccentric supramaximal training. So what is really important to understand, if you can get up from the Nordics, maybe you should use the weights when you are going down, or maybe you could get a more fast way down with the weights. So yeah, if you can go up, just use the weights on the way down. If, of course, if this is purpose of your Nordic training. But if your purpose of your Nordic training is just lifting yourself up in the concentric part of the motion, then maybe I have a better exercise for you, and maybe this would be lying or staying or sitting leg curl. I think that you can load it much easier and much efficient than just lifting yourself up in the Nordic. So the purpose of the Nordic is supramaximal or eccentric overload stimuli, and only way to keep this stimuli is if I can lower the high amount of load of force in the eccentric part of the movement than in the concentric. And how this is look like in the example, and why I share with you this this paper from Bas van Horen, because Bas van Horen he showed us that we are actually experience the most of fascicle lengthening after the breaking point. Actually, more than 84 lengthening of the master fascicles we are experience after the breaking point. And in the beginning of when I'm starting to implicate the Nordics in my practice, I was holding the band over the chest of my athletes, because I just wanted to slow them down lower. And I didn't know at this point that I just gave them the lower level of effort, less passive tension, more activation of slow twitch muscle fibers, and I get the more diameter hypertrophy. So I miss complete point of my Nordics. And it's just the same if you can lift up, if you can lift yourself up, then you are also completing you are also missing the complete point of the Nordics. So if you can get yourself up, use load on the way down, or get the more force as you are going down. So I can apply more force here. This is just one example how I can maybe add more force on the way down. And if I want to make this movement more efficient, maybe I could use also a load with my athlete and push him further down. So I will have more load, more velocity, more muscle damage, and I will for sure get the more activation of the fast twitch muscle fibers, and I will for sure get more sarcomeres in series, and I will get more fascicles length. So I will show you just now a few examples how I'm applying the eccentric training in my practice with my athletes. You will see this is for sure again eccentric training, because I'm lowering actually the weights with 2 legs, and I'm lowering with the 1, and this is for sure eccentric overload for my distal rectus femoris. Okay, I can use it also in the leg press. 2 up, and I'm going, okay, 1 down. So again, 2 up and one down. So this is one example that is not eccentric overload. And this is why this is not eccentric overload, because she's able to get through the concentric phase of the motion with the load. So if I want to add eccentric overload here, maybe I would let her go to go up in the concentric part of the motion without the weights, and I will use the weight on the way down, and then again she can lower the weights down. She can get up in the concentric part of the motion, and I can add her weights again on the way down, or I can push her down in the eccentric part of the motion. So don't be confused. This is we know that my hamstrings, especially my biceps femoris long head, is biarticular muscle. It's crossing the knee and it's crossing the hip. And on the hip is doing hip extension. And when I'm doing the hip flexion is my eccentric part of the motion. And when I'm doing the Nordics, it's actually more activation of my knee flexors, my semitendinosus and biceps femoris short head. So, and as I lift myself up, this is my concentric part of the motion. And as I go down, this is my eccentric part of the motion. So I will show you a few more examples of really super high intensive eccentric overload. So this is the one rehabilitation that I was recently doing. This is an operative ACL tear, and yeah, I was using really high supramaximal eccentric stimuli, and actually I was tie him up with the weights because intensity was really high, and without the weight without the weights he will lift his butt from the chair. So you can see it here. And I think that I have a few more of them just to show. This is also the supramaximal eccentric stimuli for the adductors. Okay, you will see that I'm doing this in the different ranges of flexion and extension.
So how many of them would you tend to do? Or when it comes to, I guess they're probably different. So that's more the force deceleration. That's where you're getting the overload versus the
Yes.
resisting the weight as such. So do you have rough set and rep visions or ideas for them?
Okay, unpopular answer, but it depends, of course. But depending if I'm in season, I will keep like 2 or 3 sets, even 4 reps, not more than this. Really, not more than this, because like we said, there is no failure in eccentric contraction mode. I could pull his femur in abduction like whole day, but only the first few reps will provide the stimuli. And also you will see the same approach for the calf muscles. And maybe I have one more, or no, this is the last one. So this was just a few examples on how I'm using the eccentric overload in my training, in my rehabilitation. So why I am using the eccentric overload or on particular tissue. So I would like, sorry, do we have some questions here?
Yeah, or? Can I ask you, because you are stuck at that video, how many months post-operation was he?
Okay. So
the
no,
leg extension overload.
so we decide to go non-operative rehabilitation. So
okay.
we didn't do the surgery. This is the 7 months post initial injury.
Okay.
Okay. Okay. So how do I know that eccentric training will provide benefits for particular tissue? So I would use again whiteboard, and I will get back again to something that is really, really, really super important, and I can highlight more. I can highlight how this is important. So I really have to know the mechanism of injury, and I really have to know the tissue. Okay. So when I'm talking about the mechanism of injury, so I will just give you some example from, let's say, the injuries that I am usually dealing with. For sure, one is hamstring. So hemis, I have quads or quadriceps femoris, I have calf muscles, and let's say we will put here adductors. Okay, so let's dig in each tissue here. So I know that most of the hamstring injuries are actually occurring in two situations. Okay, one here is sprinting, and the other mechanism is stretching. Okay, quad muscle injuries are usually consequence of three mechanisms. One is sprinting or acceleration. One is decels, and the third one is shoot mechanism. Sorry. The calf muscle injuries are consequence of also three mechanisms. Decels, or we can use it together, a change of direction, and adductors for mechanism of injury. Two of them are in closed kinetic chain, and two of them is an open kinetic chain. So we have shooting mechanism. So we have stretching. We have change of direction, and we actually have like landing or jumping after the landing. So I will just jumps here. Okay, so let's look at this muscle. Let's look at this mechanism of injury. So if you take a look at this one, sprinting, terminal phase of the sprinting. I'm not the best drawer. Okay, so we'll see this is my hamstring. Okay, this is my terminal swing phase, late swing phase. This is eccentric rotation of my hamstrings. And the second one mechanism is when I'm having contact with the ground. This is also eccentric orientation of my hamstrings, and I need to absorb the crazy amount of force. So eccentric. Stretching, mostly in the ballet, is also eccentric contraction mode. Decels for the quad. What is the role of the distal rectus femoris in the decels? He's actually decelling, and alongside with the calf, with the soleus, both of them, they are working on posterior translation of the tibia. So when I'm landing, when I'm decelerating, when I'm landing from the jump, my distal rectus femoris and my calves, especially soleus, they are doing decel, and by doing decel, they are getting through again enormous amount of forces, and they're dealing with eccentric orientation of this muscle, because calf muscle is plantar flexor, and when I'm getting to from the dorsal flexion, this is actually eccentric orientation of my muscle, and my quad, my distal quad, my distal rectus femoris is knee extensor. And when I'm going into the knee flexion, this is actually eccentric contraction mode. Shooting as well is eccentric mode of my quads. But now this is on the other tissue. Shooting will more affect my my proximal quad, my proximal rectus femoris. My proximal rectus femoris is hip flexor, and when I'm aiming for a shoot, I need first go to do a knee extension, and knee extension would put my my proximal quad, my proximal rectus femoris in eccentric orientation. When I'm doing the change of direction, before I'm able to change direction, I need to decel. And decel again is eccentric contraction mode for my quad and for my for my calves. And regarding the adductors, shooting is eccentric orientation. But if we speak about the adductors injury, more than 80% of all adductors injuries are actually adductor longus injuries. And let's speak about this tissue, okay? But before we start with the tissue, I would just love to stay here a bit longer with adductors. So when I'm doing the change of direction and when I'm doing the stretching, actually stretching, so let's say that this is posterior view of my athlete, and when he's starting to do shooting, or when he's starting to do stretching, when he wants to change direction, he's shifting his side, his body mass on femur, which is fixed, and his other femur is in external rotation and abduction. And abduction and external rotation will put my hamstring, will put my adductors in eccentric rotation. So again, a lot of hamstring injuries, during the soft tissue injuries, yes, they are exposed to high amount of stress, and they're exposed to high amount of eccentric stress. So this is the reason why I'm applying eccentric training mode in my rehabilitations. I don't like when I'm maybe wrong interpret. So please, I'm not exclusive. I'm not excluding the contraction and isometric contractions from the training. I'm just speaking now about benefits of eccentric training. So let's speak about tissue. Now, when I know the mechanism of the injury, and I can say, a lot of mechanisms here of these soft tissue injuries are coming from supramaximal eccentric contraction mode. What about the tissue? When I'm speaking about hamstrings, long fasciculus length, so I really need to keep this adaptation. So how I can get a long fasciculus length by eccentric training. Also, what my quad and my calf is experienced when they're doing deceleration, again, eccentric orientation, and especially my adductors. So why is adductor longus is the most injured adductors from all the adductors? Do you know maybe? Or I have another question. Why is biceps femoris the most injured hamstrings for all the hamstrings?
I know, but it's because you taught me.
Okay. Okay.
Okay.
Okay. So, should we let Anna to respond to this?
Yeah, Anna, go for it.
Okay.
It's because of short muscle fiber, the shortest actually.
Okay. Okay. So if we compare adductor longus to other adductor muscles, we have 5 of them: brevis, longus, gracilis, magnus. And when we are looking at this, sorry, just give me a second. When we are looking at this, we have to know architecture. We have to know that adductor longus, it has the shortest muscle fibers and the smallest cross-section area. And this is the reason why when we put our femur in extreme position, eccentric elongation, this is the reason why my adductor longus is at high risk. And again, is the same answer for the hamstrings. Why my biceps femoris is most injured from all other hamstring muscles, because if we think about the biceps femoris and semitendinosus, we could see that semitendinosus has the highest level. It has we call it that fusiform structure. It means that has the longest muscle fibers, and it can generate force, really high amount of eccentric force at really long fasciculus length. Biceps femoris has a bit shorter fasciculus length, and this is the reason why the biceps femoris is unable to tolerate, or is not proficient in tolerating the terminal phases when he's actually maximally elongated at the same amount or with the same efficiency like semitendinosus. So this is the reason why eccentric training can help you in this. So once again, mechanism of injuries, and of course we really need to understand the anatomy and all architecture of the muscle. So I think that from my personal experience, what is the best thing that I made my decision in my career, when I was able to put my ego aside, and when I was able to say to myself, okay, stop now. You really don't know nothing. You are just throwing the exercises. You really need to go back, one step back. You will start again with the anatomy. You will start again with biomechanics, and you will start again with physiology. And to be honest, physiology is never-ending story. So nobody expecting from you to really know it completely. But I do think that we have really obligations to know, to understand, to explain not just to our athletes, but at the end of the day to ourselves, why I'm applying specific tool with my athletes. So really, I have to know why. I really want to play why game constantly. So why I'm giving Nordics to my athletes, because it is a supramaximal eccentric training. And why do I need supramaximal eccentric training? Because I want to address my biceps femoris long head. And why do I need to address biceps femoris long head? Because it's the most injured muscles of all hamstrings. And if I can lift myself up from the Nordic, that means to me that, yeah, I need to apply more force. And how I can apply more force? By adding more tension in the eccentric contraction mode. So I can get more hypertrophy response, or I can get more hypertrophy response that I really need. So I'm seeking for adaptation that I really need. So for me, exercise is just a tool to achieve adaptation that I want. In the past, I was just applying exercises. Today, I think that you will agree with me. We know all the exercises. We just need to go to the YouTube, to the internet, and we know every single exercise in the world. But what we do not understand, adaptations and background behind each of these exercises. And I think that we need to spend more time in really understanding the biomechanical, the anatomical and physiological process behind each exercise. So basically, this is my approach. I'm really, like I said, critical to everything. And please, yes, I want you to be as much as you be critical to my presentation today, because if I'm something wrong and you guide me to a right path, that I think that I gain something and I learn something, and then tomorrow I will be a bit more a better coach than I am today. So this is a really approach that I really want to keep on. So I hope that this presentation was like not disturbing to you. At the beginning of my presentation, I was just trying to show to you really simple and on the stupid way what is the eccentric contraction mode, what is concentric, by using eccentric, that not every eccentric contraction mode is just the same. You need really to understand this and where to apply the eccentric in rehabilitation. So don't just think about eccentric as just a phase of the training that does not have any consequences. It has. It's amazing tool. You will get amazing benefit. You will be, yes, much stronger than if you are just doing concentric only training. But again, this is not reason to throw up the concentric training. From eccentric training, you will get really nice adaptation in fascicles length, but also be sure that you really understand the fatigue and the damage, the inflammatory process behind the eccentric training, and really be really sure when and where to apply it during the in season. So please, we need to think outside the box. I gave you example about through the deadlift, but eccentric training is not just when we are doing the strength training in the gym. It's a jumping, it's a changing of direction, it is the sprinting and everything else. And actually, you will get the much higher eccentric stimuli that you can get in the gym. So this is for sure. So if your player is playing, let's say, a football soccer game 90 minutes and he's covering a lot of volume in sprinting, then you should know that, yeah, this is eccentric overload, and for sure you don't want to give him the same or similar stimuli immediately tomorrow. Respect the recovery time, the rest time, and be sure that when you are applying again the eccentric training, that you are applying or on the local tissue that is well rested, and on the CNS that is also really well rested. So I think that is the main implication of the eccentric training in our practice. So yeah, I hope that it was really simple and stupid. I can share with you all the informations or the literature that I was having when I was getting this presentation, especially for the hamstrings. I last couple of years I'm dealing with a lot of muscle injuries and tendinopathies. So I can say that in last 2 or 3 years I'm really familiar and I dig really deep in the hamstring injury and muscle injuries, and yeah, I can share all the information and all the source also with you. If you want to listen, maybe smarter people than me, then regarding the hamstring injuries, for sure. The guys from the Australian Catholic University, alongside with Hurdam Menjigudjal, Johan Lahti, JB Marine, Joki Shuremans. If you want to learn more about the adductor injuries, Andreas Cerner, I think, is the best address you can knock on. If you want to learn about the calf injuries, you have a really nice also protocol from Aspetar. And yeah, you can always type to me on my Instagram and on my email. And yeah, if you can any answer, I would be more delighted to reply to you. If I know, if I don't know, then for sure I would say that. And I just forgot one example that will maybe you will get benefit from. I forgot to include this in my example here, but this is regarding the Copenhagen. So I think this is really important for all of you guys that are training or dealing with adductors injuries. So okay, we have to know that in the different range of motion, in the different range of flexion and extension, we have a different activation of different adductors. So when my hip is at 0 degree of hip extension or at 90 degree of hip flexion, I will get the more activation of adductor magnus. And when my hip is more extended, then I will get the more activation of adductor longus. So this is really important application in your practice. And when we are speaking about the leg cycle during the shooting, because shooting is one of the main mechanism in which we can find the adductors injuries. Can you see my whiteboard?
Yeah.
Okay, so just for the end, so let's say that I'm aiming for the shot. This is my stance leg, and this is my initial phase of shooting. Yes, and this is my actually terminal phase of the shooting, where is the ball, and at close to 35 or 45 angle from whole this leg cycle, I have the most risk on my adductor longus. So this is the reason why this range of motion I am including in my training and rehabilitation, and this is the reason why I am implying eccentric stress in that range of motion. So yeah, you can cover, sorry, you should cover different ranges of motion in the hip flexion and hip extension. So I think this is really important to understand. So one question for me, for you, for the end, and Anna, please, or keep quiet this time. So I just want to push you a bit about more about critical thinking. So when I'm doing the Copenhagen exercise, you know how I'm doing the Copenhagen exercise. I think that you're all familiar with the Copenhagen exercise. What you think about the Copenhagens, and if I'm doing the Copenhagen just body weight, am I really getting the real eccentric overload stimuli in this kind of exercise? What you think?
Feel free to put your microphone on, guys, before Konstantin answers it. Okay, Konstantin, you want to answer that?
Okay.
Should I try?
Yes, you should. Why not?
I think for most athletes who are at least fairly trained, they can hold the Copenhagen at a long lever.
Okay.
So if they can hold it basically and come up from the, like, lower themselves and get them up, it's no eccentric overload involved, right?
Yeah, that's correct. That's correct. So I do think really that Copenhagen is a great exercise, really, really great. But if I want to add more eccentric overload stimuli to my adductor longus, adductor magnus, because one more thing, Copenhagen is not the best exercise for adductor longus. You will not address adductor longus so efficient with Copenhagen. This is mostly adductor magnus exercise. But when I'm lifting myself up in the Copenhagen, this is my concentric contraction mode. And when I'm lowering myself down, this is eccentric. So actually I'm limited here. What is limiting my eccentric overload is actually concentric strength. So if I'm unable to lift myself up in the contraction mode, concentric contraction mode, so I would not be able to lower myself down during the eccentric. And how I can get more eccentric overload? I can get more eccentric overload by pushing my athlete down in the eccentric phase, or I can put some sandbag or Bulgarian bag, or let's say med ball, and maybe I will let him go up in the concentric phase of motion without load, and on the way down I will add more load, and in that way I will get the more eccentric overload. So this is just food for the thought. So yeah, don't be married to exercise. Exercise are really stupid. It's just a tool. We need really to understand the adaptation behind any of these exercises. So
has a quick question, if you don't
okay.
mind, just to finish.
Yeah.
He said, how would you, I'm just getting it up again. His question was, we've mostly talked about the high load eccentric today. What are your thoughts on high velocity eccentric training? So both submaximal and supramaximal.
Okay.
In terms of performance training and late return to play scenarios. And he means more gym-based exercises rather than sprint-based. Or
Yeah,
like
okay.
pitch-based. Yeah.
Okay. So I'm always when I'm working on eccentric overload, I'm always try to do with maxi tent, and by doing the maxi tent, I'm really applying a higher velocity to my athlete, to his tissue. So we need to know that our hypertrophy response is also close to velocity. So I will have a more muscle damage if I'm doing the eccentric overload faster than slower. So this is really important to understand. But we really need to understand the next thing, that if I'm doing the movement that is not eccentric overload, so it's a low level of effort. I'm not, and I'm able to do it fast because it's a low level of effort. I'm still just getting the velocity, or I'm providing the faster velocities to the low threshold muscle fibers. So this is really important to understand. So I like to say that we have fast movements when we are looking at this with my eye. We have a fast eccentric movements, but is not necessary activation of fast twitch muscle fibers. And if I want to get more fast twitch muscle fibers, I need overload. Okay, so I think it's a clear. I hope that I answered this question. So if I gave, like, let's say some gliders without with just body weight to my clients, and he's doing really fast, there is a possibility that it's just a phase movement. It's just it's fast movement, but I do not have activation of fast twitch muscle fibers. So if when we are speaking about the eccentric overload, yes, I will get the more hypertrophy response if I get more velocities. So let's say I'm lowering the deadlift, and let's say that that 100 kilos is my supramaximal. And if I'm lowering this phase a bit faster, I will get the more hypertrophy response, because effort and the velocity is much higher. Okay, any more questions?
Amazing. Yeah, we've got one from Alexander. When would you suggest?
Wait one thing. I think I just wanted to ask in terms of that question before. So would you say that if one athlete is, for example, a drop jump,
Okay,
which is a high eccentric velocity move, and he does it from a, like, let's say, height of a box like 30 centimeters,
okay,
that there are not as much adaptations, like, say, a box that would be slightly above what he can, like where Kushansky always said, over-challenging situation, when the box height is a bit too high to sustain optimal output. Would you say that is better if your goal is to get adaptations to titin and all that, or what is your stance?
So when I'm doing a drop jump, okay, from the box, am I following you correct?
Yeah.
Okay, for sure, this is the eccentric overload, because we need to know when I land down that actually I'm dealing with the forces that they are 2 or 3 times my body weight. So this is for sure eccentric overload. So yeah, this is eccentric overload, and this is fastest eccentric overload. And we have a really nice paper that is showing to us, I forgot who is the author of this paper. Oh my God. Yeah, I forgot, but actually we can get more hypertrophy by doing the loaded vertical jumps for my quads than for doing the squats. And the reason is because it's much higher load and it's much higher effort.
But perhaps rephrasing a bit, like, would you suggest that even higher box heights would be better than lower ones? Like, say you have a highly trained soccer player and he's used to drop jumps of 30-centimeter boxes. Would you say that you have to go up in height to see adaptations?
No, because we now have a few papers in recent years that I think that is applying to us that with high training professionals that there is no difference in box height. Yeah. I think that we can get to one plateau, but after this it's just the same. Okay.
So last question from Alexander is, if you've only got one, you can only train once a day with your athletes. So you've got like a pitch session and strength. Would you suggest to do the eccentric exercises before or after the pitch sessions?
No, I'm always doing the eccentric exercises after the pitch session.
Yeah.
So, okay, depending what is the goal. If the goal is, let's say, high velocity sprint training, so I do want anything to disturb my sprint performance. But if you ask me, I'm in the rehab and also like in season, I'm following like, I would say Charlie Francis high to low approach. Let's say if my player is playing from the one game is in Saturday and the next game is Saturday. So let's say on Wednesday, I have high velocity sprinting day. And after the sprinting, if I want to do any eccentric training for the hamstrings, I would put this immediately in this session after the sprinting. Because in that way, I'm keeping the high eccentric stimuli in one day, so I can have more time to recover in the other days. So maybe this is also a good implication, not to divide this exercise, but put it all in the one session. It's really high, and then I just want to go low in the next couple of days before I expose him again to some high velocity training, high eccentric training. So my strength training is I'm using my strength training just as a backup for my training on the pitch. So if I'm training the athlete who is not a power lifter or Olympic lifter, then everything he's doing on the pitch is much more important than what he's doing in the gym. It's just a backup. It just, for me, just accessory work.
Amazing.
I would like to ask one question.
Sure.
It's about terminology. So when you talk about eccentric overload and supramaximal eccentric, are they basically the same, or is there some difference?
There is some differences. Really stupid example. If I can lower, if I can lift 100 kilos in the concentric phase of my deadlift, and if I'm lowering down 101 kilo, this is eccentric overload, but still is not supramaximal. Okay. Let's say that we know that single muscle fibers can exert much more force when is actively lengthening, and we know that we can get more around 20 to 30% more force in the eccentric portion of the movement. So if you ask me what I think is a supramaximal for me, if I can lift up 100 kilos, then 130 kilos, 140 kilos will be for sure my supramaximal.
So it will be about 120-30% of
mass concentric. Yes, I think that you will get enough stimuli.
But there is no like clear definition in the literature.
I don't think there is a clear definition. As long as you are lowering the more weight that you can lift, I think that you are pretty much safe that you are getting the eccentric overload.
Okay, thanks.
Yeah, no way. Welcome.
Ivan, thank you so much for your time and for your expertise and just everything, man. It's been absolutely amazing. So thank you.
Thank you very much.
And any questions, go to Ivan's Instagram. He's an absolute legend and he's doing some amazing stuff. I had a good stalk the other week and I was like, I love this guy. Just you're thinking differently, as I think we all need to. So as you said, so thank you so much and have a lovely evening, everyone. Guys, we're here every 2 weeks and the next one will be on nutrition, most likely in sport and probably more in endurance sports. So it's going to be something really different, but it's going to be really, really good. I'll have the video up on YouTube in the next 2 days as well. So if you need that, either message Konstantin or myself. Okay.
Okay.
Yes.
Thank you.
From my side also, thank you, Ivan, for also letting us talk on that and invite you. That is really great that you hop on and are able to be open to discussion. So thanks for that, man.
Thank you very much for having me. If you have any question or if you have some critical thoughts on my presentation, I would really love to hear it. And of course, what I love the most is to hear the feedback if you will apply something, some of these things. So thank you one more time for having me. It was really a pleasure to me. I was really enjoying, and yeah, hope to chat with you soon. So yeah, have the lovely rest of the evening. Thank you very much.
You too. Bye bye.
Ciao, guys.